you so much for inviting me here today. It's exciting to talk to the next leaders in public health. We need your excitement. We need your enthusiasm, especially now. We've got a lot of public health folks who are tired. And so it's great to speak to people who are excited and ready to go. But today I'm actually here to talk to you about COVID-19 vaccine hesitancy and misinformation. So I have worked on pandemic preparedness and response for the past almost 12 years and worked in a lot of different areas, thinking through different policies and responses, and really came to the conclusion that you might have the best response. You might have the best vaccine. And in fact, we have a really great vaccine and many great vaccines, in fact. But if you can't get people to take them, you're sunk. And so communication is a critical part of that. And if you've worked in health communication anytime in the last few years, you've realized also you've got to deal with mis and disinformation. So putting it together here with vaccine hesitancy, a lot of the data that I'm going to cite here come out of the US. But hopefully it tracks for those of you who are from outside the country. All right, let's see. Now, when we think about vaccination intent, right, we have seen in the US, this is from Kaiser Family Foundation, their most recent poll, we've seen that the intent to get vaccinated, already got as soon as possible, those groups have really sort of picked up. Wait and see, those people have moved into the already gotten vaccinated. And so, we've seen a lot of progress in the last little while, but we do have a pretty significant number that has not shifted here in the green side, right? About 20% throughout the whole time of this poll. And we also have quite a few still waiting in the wait and see group. So we've got a lot of vaccine hesitancy here, and we're trying to think about how do we deal with it? What's going on here with vaccine hesitancy? Well, with vaccine hesitancy, we know that we have 3 C's in the factors that are influencing acceptance. We have confidence, trust in the effectiveness and the safety of vaccines, that delivery system, right? Do you trust public health or the medical system? And the motives of people establishing vaccine policies. And that can also be, do you trust pharmaceutical industry? Do you trust the government? These types of things. Complacency. Here is where the perception of where people are balancing the risk of the perception of the risk of the vaccine versus the risk of the disease that's being prevented. And many people can be complacent because they see the vaccine, they perceive the risk of the vaccine as greater than the risk of the disease. And then we also have convenience. This is about access, right? Are they available, affordable, easy to get to, delivered in an environment that people are comfortable with? Are they at a time that people can get to? Are people able to get rides to the places where they need to get vaccine? These 3 things come together and really sort of influence your vaccine uptake and rates that you're getting to with relation to the vaccine. We also have some complex causes and contributors to vaccine hesitancy. So we have these contextual influences, and these are things that are the larger influences around that are, historic, social, cultural, economic, or political. These are those big surrounding influences. And then we get a little bit closer, right, with the individual and social influences. This can be like your family, your personal preferences, these types of things. And then closer in the vaccine and vaccine specific issues. These are things that are specifically related to the vaccine. One example might be with the COVID-19 vaccine, that some people say some people believe that the vaccine was developed too quickly or something like that. So it's a very specific thing with that vaccine. And these all come together to form kind of the contributors to vaccine hesitancy. Now I'm going to talk a little bit about theory because some people think that theory is quite boring, and I will tell you right now, the reason why theory is important, and even I thought it was boring before, but the reason it's important is because it creates the foundation for the ways that in which we sort of academically and in practice think through the world, and can give us ideas on where to go next. So this is one of the prominent thinkers in risk perception theory is Paul Slovic, and he has 2 different sort of factors when it comes, or two different sets of factors when it comes to thinking about how people perceive risk, right? So one is how dreaded it is, and the controllability, how catastrophic it can be or fatal. The risk to future generations. Often we see people perceive risks to be much greater if they affect children, or fertility. The voluntariness about these types of risks, these things that are combined to make a risks, the perception of the risk much greater. We also have another factor here, which is related to, or set of factors here related to how known or unknown that risk is, right? If it's not observable, if it's not known, if it's unknown to those exposed, or the effect might be delayed, if it's new or unknown to science, people really do perceive the risk to be much greater. Radiation is a great example of risk that is perceived to be much higher than it is because of these features. Now, when we think about potential perspectives on vaccine, now obviously, this is for a vaccine hesitant person. For someone who is confident about vaccines, they're not going to be, these are not things that really sort of come into their minds when they're thinking about it. But for someone who's worried or hesitant, they may think, okay, do I have control over this? It is a mandate coming down the road. Do we really know? Do we have enough data? This is my body, the personal kind of risk, if it's new or unfamiliar. Many people see vaccines as unnatural, as opposed to sort of, organic, natural, that kind of thinking. What I was talking about before with the complacency, they may see a questionable benefit, and often they have poor trust in authorities. So that all comes together when we sort of put a graph down with unknown and the dread risk. We see that for people who are, who have these concerns about the vaccine, that can make their risk perception really go up into this high risk perception upper right quadrant. And so, the other thing is that vaccine myths are having a part to play in these concerns that people have. They really do matter. If we look to see, this is again US data from Kaiser Family Foundation, collected in April, that just recently came out, we can see that half of the public believe or unsure about these common COVID-19 vaccine myths. You can see the net, basically, people who've heard at least one of these myths and either say it's true or they don't know if it's true. The leading one here is that people think that they might be able to get COVID-19 from the vaccine. We know that's not true. None of these vaccines contain enough of any part of the virus in a way that it can reproduce itself. And none of the ones, at least, none of them. But certainly the ones in the US, we know that's 100% not the case. And so the people who are being polled are hearing these rumors from somewhere, right? And there's a number of rumors that also can make people question whether they want to get the vaccine. So we have a lot of rumors. We have a lot of misinformation and disinformation. This is a problem. And this is not the only reason why people are vaccine hesitant, but it is certainly a reason why people are vaccine hesitant. So let's dive in here more and figure out what's going on here with misinformation and disinformation. So first of all, many of you may have heard about the infodemic. This is something the WHO declared actually back in February 2020, saying, we have a rapid, large-scale spread of health information and misinformation through a variety of media and informational channels. And this overabundance of information, and some of it is accurate and some of it is not, is really difficult for people to sort through and distinguish between true and false information. People are just getting so much, the way that they select this information is often not random, right? And not really based, and often can be based on sort of factors that may not be helpful for getting them good information. So people can really select certain types of information rather than, having good information fed to them, and not be sort of overwhelmed by other information that they're getting. We have misinformation and disinformation. I want to emphasize the definitions here. So misinformation is information that's false in the context of the scientific understanding of the time. And that's often the result of ignorance or poor understanding. Now, I say in the context of scientific understanding of the time because science evolves. And so just because science evolves doesn't mean if you're, trying to describe what you know based on the facts of the time, and that changes over time, that you you were providing misinformation before. That's, we have to accept that science is something that we're always collecting data, and we might change what we have to say. Now, that's also not to say that there cannot be dissent. We have to agree on the basic facts, but your opinions based on those facts is, if people disagree, that's not one person saying misinformation, the other person not. People have the ability to, there's plenty of space for people to disagree, have dissent, to interpret the facts differently, especially based on different values that they may have. And I think that that's fair. But we also have disinformation, and this is much more insidious. Okay, so this is purposefully created and disseminated falsehoods, again, in the context of the scientific information at the time. So people here are creating these falsehoods. They know them to be false, and they're spreading them often for their own social, political, financial gains. And so, I'll talk about this a little bit later, but, a health issue that you think is purely health related can often be used as a vehicle for these other goals. And disinformation and misinformation can be part of that process. Oh, okay, let me just zoom in through this. We usually have, my team has sort of divided the rumors that we've seen into 4 different types. Other people may separate them differently, but here's how we're kind of bidding it. So we have false cures, and we had a lot of these at the beginning of the pandemic. And actually, this is based on our research on Ebola, but we saw basically the same thing in COVID. But we saw a group of rumors related to false cures. So we had it's like the miracle mineral solution, which is really chlorine dioxide, which is a form of bleach. People were saying that would cure your COVID. That does not cure COVID. It's actually quite dangerous. There also is mischaracterizing disease or protective measures. So we all have heard these rumors about the chips. Obviously, this is not a realistic situation. We've also seen a lot of scapegoating. Actually, I pulled this headline in June 2020. It's June 2021, and Asian American harassment has only increased over that year. And so the scapegoating is another issue that we have to deal with. And then we have conspiracies, including accusations of profiteering. And I actually have a picture of myself here because we were looking at our Twitter data set and trying to find and sort through the misinformation and disinformation there. And we actually found a video of me, which was incredibly meta. That, we're looking for misinformation. I'm a misinformation researcher, and here I am actually featured in misinformation. This was actually related to a coronavirus exercise that I co-led in October 2019, and it was also we did this with the World Economic Forum and the Gates Foundation, and this, there were accusations that this was just a practice run, which of course it was actually even featured in some of the pandemic movies, the second one, which was just blatant lies. They said, who wrote this? And it's like, you wouldn't have gotten any of this footage. You got this footage off our website. That we wrote this, and that it was, clearly defined as a way to sort of raise awareness and improve public-private partnerships about pandemic preparedness. You try to say that one 3 times fast. But anyway, this was a great example, though, of conspiracy theories and, in some ways, accusations about profiteering. So a lot of people want to know, okay, well, how do I check for false information? Most people are confident, though, that their information sources are good. And let me tell you, no one's information sources are 100% good. It's really a good idea even if you're utterly confident, to make sure that you use these tools every once in a while, because we all have our own biases, and we need to make sure that we're checking them. So the first thing that people can use is web-based tools to assess source credibility. And a lot of the times my team for a while was using NewsGuard when we were checking different sources. But there are a number of tools out there that can sort of help you figure out what's going on with a website. The other thing you can do is you can review other content from that source and also evaluate the level of editorial oversight at that source. So if it looks like one dude is running a website, this is not a good source for you. It's not trustworthy. If the other articles on this website are also, you know something about them or whatever, and also seem a little bit off, yeah, I would just, close the window. It's not a good source. The other thing that you can do is increase your awareness of disinformation tactics. And if you look around, there are actually gamified approaches to this that allow people to kind of understand what's happening, why something might be, how something might be working as a disinformation campaign. And then because they know these processes, people are better at spotting them when they're targeted by these techniques. And so that can actually be quite helpful. The other thing you can do, or you can, this is another thing you can suggest that people do if you're trying to help someone else out, to verify with other news sources. In fact, often news sources that are on the other side of the political spectrum from what you've been looking at, just to understand the framing, the differences in framing and what's going on. And you can also use fact-checking sites. So I actually really like the USA Today fact-checking site, but there are many out there that do a great job. And there are really the people in the trenches doing some really good work there, calling people up, calling experts up, hearing straight from them what's going on. It can these resources are really good. But people should also be wary of these messages that are designed to appeal to their emotions. So if you read something, you're like, what? Generally, let's take a deep breath and think about what's going on here, and also be careful before you click it. You really don't want to have malware on your computer. And finally, understand your own personal biases and capacity to change opinion when you're presented with new evidence. If you feel like no evidence would change your mind at all, this is a danger sign, right? You want to be able to get new information, reevaluate it. And in fact, I ran a crowdsourced forecasting platform for a while, and the people who do the best on forecasting new outcomes going in about all kinds of different things, they are people who are able to take new evidence and change their minds. They're not stuck on a prior that gets them stuck in a certain way of thinking. I want to talk briefly here about our that Ebola study that I was talking about earlier. I think it might put a little bit of context here into what we're actually talking about. So we actually sorted sorted these tweets into different sort of categories. We had true information. Here's an example: a Texas patient is the first confirmed Ebola case that's been diagnosed in the US. We have really false information that's fairly obvious, that Ebola is a staged event to pillage Africa's natural resources. We know that that's false. Then we had things that we weren't able to tell if it was true or not, basically a statement that we can't evaluate. But we also had this really difficult category of half true, misinterpreting the truth. And in fact, this is now what we see a lot of what's happening with a lot of mis and disinformation. So in this case, the tweet was, there's an Ebola patient in Fairfax County Hospital. I'm going to Canada. At least I hope that's what it says. I'm kind of cut off here on my video screen. But anyway, that technically there was a patient being evaluated for Ebola in Fairfax County Hospital. But the tweet gives the suggestion that that person had Ebola, which that person didn't. And so this is what happens when people are sort of getting this information, is that a lot of times there is a kernel of truth there, and it's spun in such a way that it's then misleading. And they feed into a larger narrative that then someone is surrounded by these, a bunch of these different sort of half-true misinterpretations. And it becomes something that it's really hard to peel away from someone. So say someone is, concerned they hear a set of rumors about pharmaceutical companies. They hear a set of rumors about CDC. They hear a set of rumors that COVID isn't real. They hear these other, and it starts to all feed together into a larger sort of conspiracy narrative that then you just can't pull them out of it by taking one of these falsehoods away. You've got to deal with a lot, and this can be very, very difficult. And in time, sometimes some people are very deep in that, and it's hard to get them out of that. Sometimes impossible. But anyway, so back to our Ebola study. So we had actually 10% of our tweets were either false or partially false. Now, is that a lot? I don't know. That probably is a lot if you're in a group that really is like an echo chamber of these falsehoods, or you're only following certain types of people who are anti-vaxxers or conspiracy theorists. And other people who are more scientists may get less of this false information. So it depends really what is a lot versus what is a little, but certainly there's plenty of falsehoods out there in Twitter. And this was obviously in 2014. And it's I think these issues have only gained prominence in the last little while. We also saw some things happening here with Discord, or things that provoked a response, right? These were things that like got people mad, or got people riled up, or wanted them to tweet back or something like that. And so, we saw a lot of things, examples, political things with hashtag TCOT. That's it was a conservative hashtag. I think it's kind of faded away a little bit recently. Or P2, which was a progressive hashtag. And actually, in fact, we saw something here with both hashtags, which I think really was something designed to get people stressed out and upset. The GOP is worried about Ebola getting over the border. Mr. Duncan flew in legally. There was some profanity there, which I'm not going to include here, but that he didn't sneak in from Mexico. Then it hashtags all of these different things, and it's really there and gets people really riled up. So a couple other interesting findings here. 42% of the tweets that we looked at contained risk elevating messages. That's a lot. And the most frequent rumor mentioned focused on a government conspiracy. We also saw that more often tweets containing misinformation also tended to promote discord, were political, were risk increasing. So these are some of the features that we saw in that misinformation group of tweets. So what does that really mean? Well, it does indicate that we see a bit of the politicization that we've seen in COVID is not necessarily new, but it is a bit more extreme. But we saw it back here in 2014, and that these are really often vehicles for these other agendas. Even though you might think, well, this is a health issue, it should just be, people should be talking about health issues. That's not the case. So what can we do? What are some of our critical needs here? So one of the most important things to do in risk communication and trying to talk to people who have some issues here is to maintain and build trust. So at this point in for example, in the vaccine campaign, big campaigns are not going to work. We really need to work with trusted community members. This can include religious leaders or doctors or other community pillars of the community, people who can help get those messages out there, help and build trust. The most important thing though with this is that people don't get burned, right? You got to tell them true information. They don't want to get spin and find out later that they're now on the hook for something that wasn't quite right. Also, to be transparent, collect that data, share it, make sure that people know what's going on, even if something is going on that's wrong. I have felt that, even though there were some people who were worried after the Johnson & Johnson pause, I do think that it gives us a little bit more faith that these safety signals, if there are safety signals from these vaccines, that they're being transparent about it, that we know about them, because the worst thing is to think that someone's hiding something and feel like maybe you don't know the whole story. Another thing here is to engage with identity, right? We have values, core beliefs, our personal identity and affiliations. These things are critical we want to be able to make sure that we listen to those concerns and what concerns are and what personal priorities we may have to deal with. And then finally, we need to communicate uncertainty, right? We need to foreshadow when something might change, identify what's known, what's not known, what's being done to fill those gaps, because otherwise people will just you'll get trapped into a point in which people will say, well, you didn't tell me that this was going to happen, and this is a problem. So I think this is an important part to consider when you're communicating about these types of issues. I also want to sort of do a little bit of a detour here. We have enough time to just talk about a recent report that I put out that has to do with a call for a national strategy to combat health-related misinformation and disinformation. So how do we deal with this, right? This is a big problem, and it's not really a problem that's going to be solved by one stakeholder. So we sort of had a number of recommendations that we think are really important. The first thing here is to intervene against false and damaging content, as well as the sources propagating it. So, it needs to be a national security issue. It would be great to have a commission that sort of set up the guide rails for how to deal with this. And then finally, we need to have, intervention from social media and news media. But I put that last. I think it's important, but I don't think that it solves 100% of the issue. We can come up with problems of what can happen when social media companies or news media is actually determining what's true and what's not true. And that can be something that can be kind of fraught. The second thing here is to promote and ensure the abundant presence and dissemination of factual information, right? So this means prioritizing public health risk communication. A lot of times in public health departments, and I've done interviews with public health communicators who are trying to communicate about Zika, and a lot of them said, look, it's just me. It's one person doing everything. And that is really tough. We need to prioritize it. We need to fund it. We need to make sure that there are the resources that are available for people to do a good job. Because if there's one person who's handling it all, this can really, undermine your communication efforts. They just can't keep up. The other thing to do is coordinate between public health experts and sources of public information. So JHU is actually, the School of Public Health has done a lot. I've worked with them to create Facebook videos that then go on to Facebook for their resource center, and they get viewed. One of them was viewed over 1 million times. These types of resources are really helpful to get, bridge that gap between, research and the public, and also to communicate with the news media. Some of the news media that I actually try to focus on is in fact local news media, because people trust local news media. They have it on every morning. They're people, faces they're familiar, and they know people. And so this can actually be more valuable in many cases, especially when it comes to public health, because a lot of the big newspapers, more liberal sources or progressive sources, the message is already out there. There's nothing new that I can tell someone that will convince them to do something, because they've already most of the time complied with public health guidance. So new sources, audiences that might not be as receptive. I get, I occasionally will get some hate mail, but I just feel like maybe it means that I'm getting to someone else who's new, who hasn't been as familiar with these arguments. Our third sort of suggestion here is that, we need to increase public resilience to misinformation and disinformation. So, these are some of the things that I was talking about before, promoting health and digital literacy. I think a lot of younger folks are learning about these things in schools. Although there was a disappointing study that I saw recently that, people were not able to, these high schoolers in this one study weren't able to distinguish this Russian propaganda video from, identified as false. But for the most part, kids are in younger grades are learning about, even, from the very beginning, are learning about what good sources are. And so this is a process that I think is moving forward. But community organizations, they can be helpful to older folks who, need to learn the ropes of digital literacy. Social media, news media, and others can sort of promote these healthy habits for making sure that people have good digital literacy. And also to provide, like I was mentioning before, these resources for public verification of questionable content. So that's checking sites, these digital tools. But people need that first step to know that they need to go to the tools to give them more information. So that's an important component there. And finally, the fourth pillar here is to just talk about, to have every stakeholder involved, right? So we need to have, social media, news media, government, national security officials, public health officials, scientists, and the public be part of this strategy. I mean, these are people, these are the groups that are involved. And I don't think that we make a lot of progress without getting everyone involved, because otherwise it's just a game of whack-a-mole. And then, of course, we have, there's a range of stakeholders in the government, Department of Defense, Health and Human Services, Homeland Security, as well as intelligence agencies, because we know that it's not just domestic mis and disinformation that we're dealing with. This is also foreign influence. So anyways, just to wrap up here with a couple sort of take-home things that you can use, hopefully, in your own interactions. This is responding to people who believe false information. So the first thing here is to engage respectfully, right? Your crazy uncle who's sending you messages on WhatsApp that is, that are clearly wrong. Let's just start with respect, right? We need to engage respectfully. No one is going to be convinced by you just saying, no, you're wrong. And also just pouring studies on people doesn't really generally convince them. The first thing to do here is to connect on values. So there are things that you share in common, things that you all think that are important. Connect on those first. Then talk about those tactics, how misinformation draws you in. Talk about alternative explanations for the things that people are concerned about. Also encourage verification of these facts or these rumors, and provide the true information and the alternative sources of information that can be trusted. Now, if you have someone who already believes false information and doesn't trust the CDC, you might need a non-governmental source. JHU is a good suggestion there, but you might have to work with the person you're talking to figure out what's a source that you can both agree will work for you. Importantly, if you come across false information, don't spread the lie. So if you see it on Twitter or whatever, don't retweet it with a quote that says this is wrong, because people just remember the thing that's wrong. They remember the lie more than they remember the truth. They're juicier, more exciting. People just remember that. I see that I have a question. I have 2 more slides after this, and then you'll be first up. The next thing to do is, if you don't know the source or who the source is not legitimate, limit your direct engagement. So make sure that, you might have a lot of followers, you might have a lot of people, that person might be reaching 200 people, and all of a sudden you are engaging with it, and now everyone has heard about it too. So just, at this point, if you don't know who it is, don't engage. The other thing you can do instead of that is to report it to social media companies, and you can sort of use your networks to provide true information. So 2 slides here about building vaccine trust. So the first thing to do is to understand the varying reasoning. Like if we come back to vaccine trust, understand the varying reasons for that hesitancy. Continue to ask why, understand more about what's going on in people's heads. That can really help. It can help you determine if you're ever going to be able to make a dent. Some people are very convinced that, and you can realize by sort of asking more about what they're thinking, that there's some battles to be fought and some not to be fought. To engage, right? Trusted individuals. These can often be family members, people like you, doctors or religious community leaders. Bring these people in to increase trust. A lot of times, for vaccine to increase trust, this can happen in having it in a convenient and trusted location, like churches, pharmacies, doctor offices. Also something where people can get to really easy. That's really important. And here you can also, continue this 2-way communication, update your efforts based on what people are telling you, and also realize when things aren't working. To think about the different motivations that people might have to get vaccinated, some people might be motivated differently, right? Some people might say, might be convinced by doing this for your community or doing this for, your elderly relative who, who needs to be surrounded by people who are vaccinated, or someone who is immunocompromised and they're protected by the people around them being protected. Other people might just be convinced because it's more convenient. You can travel more easily. You can, you won't get sick and cause your kids to miss, well, like not you guys, but older people my age. I don't want to get sick because I don't want my kids to miss school because I don't want them to be home for 2 weeks. So these are kind of like a convenience things that people might be motivated by. Sometimes people can be motivated by nudges if you're talking to them more often. And we've seen that incentives can work. A lot of times you may have heard about the lotteries. I don't know if it's the lottery itself that people are like, I'm going to win $1 million. I think it's a deadline that you need to get your vaccination done by this deadline in order to enter the lottery. And now all of a sudden you're like, oh, well, it's not some far off future thing I'm going to do. I'm going to do it before the end of this week. So that's one thing. And then, I just want to emphasize that patience is so important. This might not happen overnight, or in some cases even ever. So that's what I've got for you today. I'll actually stop the share so I can see you guys' faces. And Charlotte, I see that you have a question.
Yes, hello. My name is Charlotte Cunningham, and I'm a sophomore from Arlington, Virginia. Thank you so much for your presentation, which is super interesting and informative. Let's say you know someone who views a famous person's social media account who on the side tends to spread around false or misleading information. So while your friend really enjoys viewing their content, they're also getting exposed to these incorrect messages. How do you help guide this friend?
Well, I think that you're right that there can be some influencers who can be spreading false content. And that is really difficult to deal with. But, I think sometimes you might say to your friend, well, this person has really enjoyable content in this one area. We should know this person's not a doctor. Let's not worry about, let's not follow this person on some of these other topics. But, I think trying to convince a person not to, follow the influencer at all might be a difficult ask. And just to sort of separate, this person has great makeup tips or really good, style or whatever. Great, but not a vaccine expert. I think that's probably the best way to differentiate.
Hello, I just wanted to thank you for that eye-opening presentation. I'm Prashok Hesaredi, a rising sophomore from Solon, Ohio. My question is, so you briefly mentioned how there should be guidelines helping social media companies manage fake information online. So how do you think those guidelines should be established and who should make them?
Yeah, so, Facebook does, a lot of these social media companies do have their own groups to do this, but I actually think that we should raise it up to a level that we have a larger sort of national commission to do this. And I think that it should be a lot of different stakeholders. So people from social media companies, but also people from the news media, people from science, and bioethicists. I think that sometimes it's very difficult to judge what should be happening here because we have so much gray area. And so, it requires some nuanced thinking. We don't want to totally, squash dissent, because a lot of times, we need to have this variety in thinking in order to, come up with new options about what's, the way we should respond. And in fact, early on, stuff that might have been misinformation about the spread of the new coronavirus turned out was being squashed, but it turned out to be true. Partially true. It wasn't the original SARS, right? So this is something that we have to be careful that we don't do too much. We don't limit it by too much.
Hi, Dr. Sell. Thank you so much for the great presentation. I really learned a lot. And I think misinformation is one of those things that is really prevalent in today's modern society. So I'm Hurry. I'm a rising senior here in San Jose, California. My question is, in the news of late, we've been noticing a lot more talk about the Wuhan lab theory and the origins of COVID-19. And I mean, previously we used to hear a lot about the COVID being, jumping from animals to humans. And now we're hearing a lot about the Wuhan lab theory, and a lot of famous news articles like the WSJ kind of talked about the Wuhan lab theory, and there are others that talked about evolving from bats and snakes. So how do we go about perceiving these types of origins, or how do we go about figuring out which one is truth and which one is conspiracy at that point?
Yeah, so this is a tough question. I think early on there was a lot of pushback against the lab theory because it was all twisted up in sort of anti-Asian sentiment, and also people were not differentiating between a bioweapon and a lab leak. Now those things have been separated, but I still think the most important thing to remember here is that we are not going to find a final answer here. So it might be either one of these theories is possible, but we're not going to be able to gather that information. If it was a lab leak, is long gone, if it was that case. And if it's a natural origin, it's very hard to determine that. So instead, what I think we should do is say, what would we need to do in general? We would need to increase labs biosafety in different labs. We would need to ensure that we have a culture of biosafety, that it politically is something we invest in, that we make sure that we are following procedures and protocols, that lab workers are safe, they have PPE. These types of things I think we can do regardless of if we come to a final conclusion, which I think we won't. And we also need to make sure that it doesn't get wrapped up in as a political vehicle for some other agenda.
Hi, I'm Neil. I'm a rising junior at Saline High School in Saline, Michigan. And I was wondering if, one, you could explain what exactly the J&J pause did in terms of mis and disinformation. And also, given the abrupt rise in vaccine hesitancy following the pause, do you think it was the right thing to do?
Yeah, so the J&J pause, I don't know if it fed into a lot of the mis and disinformation that's out there about, accusations of harm from the vaccine. I do think that it was the right thing to do. I think they couldn't have done anything else, couldn't have responsibly done anything else, right? If there was, information always gets out, and that's why I think it's always best to be transparent and upfront, because people are going to know. And if, sometime down the road, there's some, it comes out that there was a hiding of a safety signal. We've damaged COVID-19 vaccination, but we've damaged vaccination campaigns across the board. And so I think it's really important. This transparency is so important. I do think that vaccine hesitancy did increase after that, but I think there wasn't another choice, unfortunately.
Hi, I'm Ariana. I'm a rising senior in Chicago. And I was just wondering, how would you suggest to convince relatives, let's say, to get the vaccine, especially within marginalized groups who have historically have been harmed at the hands of the government, and actually gaining that trust to show that this one will be okay?
Yeah, I think in those groups, it really comes down to the trusted voices, right? I think, and oftentimes, Dr. Fauci's voice has gone as far as it can, and that, we need to get to people who are part of those communities. We need to talk about how, vaccination can protect those around you. We need to hear voices from people who look like the medical voices from people who look like the people in those communities, who sound like the people in those communities. This is just so important because, I think that, the value of shared experience and knowing where people come from is really important. And I think that we're at the point now where that's really going to be the way to make gains in this vaccine campaign. I don't think it's going to be an overall sort of broad message thing. I think it's going to be, can we get trusted people in those communities to talk to others and talk through hesitancies and why people might be concerned. But it's going to be a long process. Thanks for your question.
Hi, my name is Devangana Shah, and I'm from Arizona. I'm a rising junior. My question was, do you think that censorship plays a role in false information, like countries like China or North Korea, do you think they have more or less misinformation and disinformation? Is there anything you know about that?
Well, I personally don't know. I can't compare necessarily, but I do think that censorship is tricky. First of all, because now someone's deciding what's true and what's not, and sometimes we know that I've emphasized that there's a lot of gray area there, and also it can sort of create a sense of martyrdom. That people who are anti-vaxxers who are spreading false information, they get pulled off their platforms, and now everyone's like, look, the man's out to get them. Everything that we said about these conspiracy theories is true. And so it's important to be careful that we don't elevate something by overly censoring it. But I do think that there are some sources that the Center for Countering Digital Hate, I think, came out with a report that said like 12 sources are responsible for most of the anti-vax content that's circulating out there. And in those cases, I do think that those sources it might be better to remove those sources.
Hello, thank you for your presentation. I'm Yuvraj, a rising sophomore in California. So my question is, how do you think people posting a picture of them getting the vaccine, whether they're celebrities or like our friends, or the resources on Facebook that show nearby like vaccine centers, how do you think that factors into vaccine hesitancy? Could that possibly outweigh the dangers of things like misinformation on social media?
Yeah. So, social media is not all bad. I'm not saying like get rid of social media. I do think that social media is a source of news for people, and we need to be able to get out good information on social media. And a lot of times I think that it's hard to be social media savvy for some of these agencies and organizations to react quickly in the ways that they need to. And so that's something that I think is important. Though, I think that the pictures of people getting their vaccine, I'm a big fan. I put mine up because it normalizes vaccines. People are like, wow, every one of my friends is out there getting a vaccine. I think that's really valuable. Now, I will say, just to tell you how biased my own Facebook feed was, like back in January, it's like every other person was posting a picture of themselves with a vaccine. And, I know that only a couple million of these have gone out. Why am I getting all of this on my Facebook feed? Well, it's because I'm a human biology major in college. And then I'm in public health. So I know all these doctors and healthcare professionals. So of course, everyone I'm friends with is getting a vaccine. So I do think it's important to do that. But it's interesting that there's a lot of bias even in, our own Facebook feeds.
Hello, thank you so much for your very insightful presentation. I'm Naharan from Georgia, and I'm a rising sophomore. So in your presentation and during the whole COVID pandemic, most of misinformation, disinformation, we saw in examples on the internet and on like websites and social media, but how did these subjects look like before the rise of the internet, and how were they combated? So for example, like maybe newspapers or something among that sort. And
Yeah.
do these past modes of misinformation and disinformation still pose a threat today?
Yeah. So short answer is yes. But the long answer is misinformation, disinformation have always been out there. And this is something that people have had to deal with for a long time. Now it gets a little trickier when we have social media, right? That it expands the reach of this misleading information, but it's certainly nothing new. And there are different instances where we've seen some of these traditional forms of communication still spreading mis and disinformation in very damaging ways. So we saw that happen in the measles outbreak in New York, where there were, in the Orthodox Jewish community, there were a lot of pamphlets that were being circulated that made people vaccine hesitant about the measles vaccine. And so sort of these traditional methods are still ways for false information to get out. And in fact, during the COVID pandemic, I actually received, I don't know if any of you guys saw, but there was this viral text chain. It wasn't even like on social media. It was a text that people got and sent along to other people. And I actually even got it. And so, it's not just the social media that these things are being spread on.
Thank you. My name is Sean. I'm a rising senior from New York. My question was, oh, first, thank you for your presentation. It was really good and interesting. And the tweets were pretty funny. So my question was, do you think that disinformation, misinformation can be stopped at the school educational level, like in um, middle schools, high schools, or do you think that once people kind of leave school, they kind of just start forming their own ideas, beliefs, stuff like that?
Yeah, so I do think that education initiatives at the middle school, high school, college level even can be helpful. But I don't think that they're, going to completely solve the problem. One, because people are still influenced by different things um, once they get out of college, and in fact maybe influenced by different things in school. Um, but I do think it makes a difference. The other thing I would note is that I think there are plenty of older folks right now who need to improve their digital literacy and you know internet hygiene processes. And so, I don't think the whole solution is with younger folks, because a lot of times I do feel like younger folks are pretty savvy when it comes to the internet. So I think that we need kind of a effort throughout many different age groups.